preventive health is not easy, right? You have to have sustained motivation. So we're using some behavioral tools there to bring them to better nutrition and help them sustain that. How do we really, really at scale move people to think about preventive services? How do we get them to think about being agents of their own health?
New choices, new players, new models of care. You know consumer first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Welcome back to the leading podcast about consumer-centered healthcare. This is episode 363. I'm Jared Johnson, and here's what's going to go down today. We have the flavor of the week about Amazon Pharmacy expanding same-day delivery of medications. What can we learn from their expansion, and how can we double down on simple consumer insights in other areas of health and wellness journeys? I'll talk about that. Then join us in welcoming Irina Pelphrey, VP of Health and Managed Care for Albertsons. If you thought you knew what grocery retailers are capable of when it comes to helping with health and wellness, you're going to get a lot out of this conversation. Irina connects the dots between food as medicine, prevention, medication adherence, behavior change, and ultimately lifestyle modification. You wanted awesomeness on this show, folks, and you're getting more awesomeness today. So it's time to dive right in. Are you ready? Let's go.
Flavor of the week.
Even Amazon's low-key announcements give us reason to pay attention. Minus the pomp and circumstance of what we've come to expect, on October 9th, Amazon Pharmacy announced its plans to expand same-day delivery of medications. They announced that they'll be accelerating their rollout of new pharmacies, offering fast, free delivery of prescription medications in 20 more U.S. cities in the year 2025. It will more than double the number of cities where customers can get same-day delivery of their medications. To make it happen, Amazon is leveraging its vast logistics network and advanced automation technology to solve one of pharmacy's biggest pain points: the lack of convenient, affordable access to medications. How will they work? The new pharmacies will be embedded in Amazon's same-day delivery sites, enabling faster delivery of medication directly to a customer's door. From their press release, Amazon Pharmacy is a digital-first pharmacy offering a simple ordering experience, 24/7 access to a pharmacist, and many ways to save. With the expansion into new cities, customers in Boston, Dallas, Minneapolis, Philadelphia, San Diego, and other metro areas will soon enjoy fast, free delivery of their medications, and other cities will be announced in the coming months. Since launching in 2020, Amazon Pharmacy has focused on driving simple innovations that help people better find and afford their medications. Amazon Pharmacy customers enjoy automatic coupons and the option to see estimated insurance pricing and Prime saving offers. These include RX Pass, a $5 a month subscription program offering access to 60 common medications, and the Prime prescription savings benefit, which provides up to 80% off generic meds and 40% off brand names. Candidly, just about everything that Amazon does in healthcare intrigues me, and maybe that makes sense given that this show focuses on consumer-centered healthcare. But it's interesting because as Amazon doubles down on their areas of strength, which is what they appear to be doing with Amazon Pharmacy, One Medical, and RX Pass, I believe the details are likely to draw less public attention and therefore less scrutiny. This follows a model that I believe holds sway here. Someone may have done this already, and if they have, I'd love to see it. But if we could plot the execution of disruption on one axis and the hype of disruption on another, I believe they're inversely correlated, meaning as one rises, the other falls. So in this case, the announcement of each Amazon healthcare-related business unit over the last several years has drawn a lot of attention. Yet as they dig in and execute on these incremental milestones of those initial claims of disruption with things like making the move from 2-day shipping to same-day shipping on prescription meds, I believe we hear less about it, at least in public forums. I share that to say I don't see many people talking about this yet, but it's important in terms of transforming millions of consumer journeys. Why, you ask? Back to the press release, which includes a quote from Hannah McClellan, Amazon Pharmacy's VP of Operations, Product, and Technology. Hannah said, "Our data shows that when customers learn they can get their medications quickly, they're more likely to order them. It's a surprisingly simple finding that shows how Amazon can support better healthcare engagement and adherence." So cheers for this quote-unquote simple finding and other consumer insights that Amazon's going to continue acting on while others are out there looking for the next unicorn. Let's double down on simple insights that can have oversized impacts on consumers' health and wellness journeys, especially when they aren't overhyped. That's another way that we'll build the healthcare of tomorrow, and that's the flavor of the week.
flow, the flow, the flow.
All right, everyone, let's get into the flow. Hey, Zane, how have you been?
Hey, Jared, good to be here. Been doing good. I guess we'll see whenever this show actually gets put out to the masses, but it very much feels like fall here in Detroit. So I'm lamenting that summer feels over, but it happened very quickly, but excited to be here.
Excellent. Well, I'm curious what you hope to get out of today's episode. I'm real excited because this is a topic we've been diving into kind of from the edges. And so now we get to fully dive in and hear a lot more about it. What are you hoping to hear from today's interview?
Yeah, super excited to have Albertsons. And, obviously we've been talking about retail health for a long time, and it's a topic of our informal discussions amongst our community. So super excited. I'm excited just to dive in to understand specifically what they do, what they're trying to achieve in healthcare. I feel personally connected to it. I think we've chatted about this before, but my family owns greenhouses over in Canada, and we sell a lot of our produce and food into some of these retailers. And so it will really be interesting to see how this is approached from the other side, from the healthcare side of my life, and what that looks like. And I have a number of friends that work in the grocery business and retail business, so it'll be really cool just to see what they can bring to the table today.
I see what you did there. Bring to the table. All right, let's do this.
Yes.
Let's welcome in our guest. We're here with Irina Pelphrey. Irina is the VP of Health and Managed Care for Albertsons Companies. So we're really excited for this. Irina, welcome to the Healthcare Wrap.
Hi, Jared. Hi, Zane. Great to be here.
Thanks for being here.
Yeah, help us get to know you a little bit better here. What's the 2-minute version of who you are and what you do?
Yeah, so I'm a healthcare retail executive. I lead health for Albertsons, which has many facets, but one central one is we have a digital health platform for our customers. It's called Sincerely Health. It's closely connected to our pharmacy operations and to all of our merchandising assortment in the store. And our objective is to help customers get healthier and increase our stickiness with us and be a resource for them through the platform. I'll talk a little bit more about specifically how we do it, but I have background in retail healthcare with another retailer, having many years under my belt of solving pharmacy problems, procurement, supply chain, managed care, kind of in this retail wellness space. Glad to be here.
Irina, could you, I apologize for maybe being a little bit ignorant, but I know retail and especially big grocers can be very regional. Could you tell us what are some of the brands that people might notice that is part of the Albertsons family? I know up here in Michigan, it's very much Kroger, Meijer, Whole Foods. But for those that may not be in an area that an Albertson brand is, can you just tell us what are some of the other logos that are associated with your company, just so folks understand who we're really talking to here?
Absolutely. So we have presence in 34 states. Some of the most famous and beloved banners are Safeway, Vons. In your neck of the woods, Zane, it's Jewel Osco. It's kind of an Illinois staple. A lot of people know. I live in Dallas, so for me, it's Tom Thumb, Market Street, United Supermarkets are the Texas-based representation. I would say Safeway is one of our largest banners and most well-known, which covers Pacific Northwest and California. So yeah, and we have 2,300 stores across the country and 1,700 of them have pharmacies. So we do quite a bit from kind of access to healthcare perspective with our pharmacists playing an important role in those communities.
That's a huge scale. I don't think any traditional health system has that type of footprint yet.
Oh, yeah. I think we'll be talking about scale a lot here. And I think that's a perfect way to dive in here because you mentioned the goal here, Irina, is to help improve health and wellness. What are some of those specific ways or specific problems that Albertsons is trying to solve with people's health and wellness?
There are a couple of things. We're really focused on prevention and medication adherence with our pharmacy practice. So right now, it's respiratory season. A lot of people are thinking about protecting their families. We welcome you to get your immunizations at Albertsons pharmacies, of course. Jared, we have some locations in your neck of the woods. Come in, get your flu and COVID vaccines. So prevention is definitely one. Medication adherence and accessible clinical services. It's anything from, hey, we dispense your medication, but we also make sure that you're compliant and other healthcare stakeholders care about that medication adherence and proportion of days covered is, one of the STAR and HEDIS measures that's important. But we go deeper, right? We do things like administration of antipsychotics and substance abuse disorder medications, things that typically maybe a psychiatry office would do in terms of administering the medication. It can be done in a pharmacy setting now. So we play a larger role. So I talked a little bit in my introduction about Sincerely Health, which is our digital platform. There we actually are focused on behavior change and lifestyle modification. So Sincerely Health offers solutions that cover your whole health. So anything ranging from sleep, mindfulness, activity, physical health, things like that. We're obviously, as a grocer, very, very focused on nutrition. So we have a lot of proprietary tech and capabilities developed there to help customers kind of take out the guesswork of their daily decisions, whether it's reading the label or putting together a meal plan that makes sense for them and their family. Even if someone has a gluten sensitivity or another member of the family may have dietary restrictions related to their disease, diabetes or hypertension. So if you think about it from a spectrum of helping with medication dispensing and being part of treatment continuum, and also thinking about longevity prevention and disease management from kind of day to day, what you eat, how much you move, how well do you sleep, things of that nature.
I love that. Maybe it would even help to put that in context of kind of where the current state of retailers are as they're entering the primary care space. And again, a lot of our longtime listeners are aware that it's a trend we've been looking at from every angle possible as far back as we can remember. And this interesting thing that it's not stopping anytime soon. And it only I think the more retailers we've spoken with, this is unique, right? Coming from Albertsons, I think we feel the same way in that this general trend is generally good for consumers to have primary care offered from a setting like this. I just wonder what the current state is from your perspective of retailers entering the primary care space, specifically when we hear terms like primary care is going mainstream. What do we mean by that?
I'm not going to go deep into the complicated and I think at times challenging the profile of, actually running a primary care practice. You being in the industry are familiar with it. So I think it's a nuanced answer that I'm going to give you. There are lots of services that are needed as part of comprehensive primary care. So we see our retail pharmacy locations as a part of that solution. And, if you think about the backdrop of increasing PCP shortage and a lot of people going without access to basic services, we see, again, our place as being in the preventive services and disease management services. So 20, 30 years ago, vaccines were administered only in the PCP office, right? Things have changed. Pharmacists kind of changed the landscape of how COVID was handled. So just thinking about preventive immunizations, that's one area where absolutely retail pharmacies play a huge role. And it's anything from flu and COVID, respiratory seasonal to like shingles, age appropriate, children's immunizations, things like that. I think things are evolving also from a perspective of screening, testing, and diagnostics. More and more pharmacists are able to deliver a lot of point of care tests, anything from screening for contagious diseases to things like lipids and A1C and deliver the result right away. That solves for access, that solves for convenience because, we see customers visit us at least once a week for their grocery trip. So if they can knock out one more thing on their list that week, we want to be there for them. And I think another trend that's really exciting right now, many states are progressive in the way they view pharmacists as a practitioner, allowing testing, in some cases treatment under a supervision of collaborating physician, writing prescriptions for certain disease states. So I think in small ways, retail is enhancing how primary care is delivered. So I don't think in a lot of cases there's AMA and Pharmacist Association. There's actually more work and more services that need to be delivered than our current infrastructure can handle. So I think this will be for the benefit of patients. This expansion of what does primary care going mainstream and retail look like? I think that's the beginning of what it will be.
Very cool. I think, part of that interested me, and Zane, I'd love to hear what you think about this too, just the thought of how this has evolved. And admittedly, this is a space in retail that has always just kind of made sense to me. I'm of course, primary care should be coming from here. Of course, the pieces that you're just sharing make sense, especially as you talk about preventive. We've been focusing more on the preventive side lately, and where does traditional healthcare fit because it's not the be all end all, services all ends of our health and wellness in our lives. It was never meant to be, but when it's tried to do that, it doesn't work. So having primary care available in other areas, from other brands, trusted brands that are already associated with other areas of our well-being, I think it's always just made sense. I don't know, Zane, if you feel the same way.
I think the other piece that really interests me is we see a lot of movement. I'm curious what you think about this, Irina, is like this concept of food pharmacies. And so some of these large retailers, thinking about how they can partner with plans and, folks who are, have chronic diseases to make sure that they're getting fresh food. And so recently we've had some chronic disease management leaders, so Mata Health on the show. Even in the wearable space, folks from Oura Ring were on the show not too long. And I just really see that whole upstream part of healthcare finally starting to flourish here. And so curious, how you see your role in that as the health leader over at Albertsons.
Yeah, we absolutely see ourselves as an important player, and we have a responsibility to respond to this interest, both from healthcare payers and health equity advocates in this. Just to frame up for the listeners how I think about food as medicine. It's simply just incorporation of food for prevention and treatment of disease into standard of care. It's long overdue. It's kind of common sense, right? That what you eat does impact how you feel and impact progression and progression of disease and longevity and the things like that. We really think about it in three ways. One is preventative, which Jared, we touched on it from different angles. Another one is like disease management. So thinking about medically tailored groceries, medically tailored meals, and really matching them to the disease state. Angle that we bring is, I would say, personalization at a higher level. It's important not to just give you medically tailored, ethnically appropriate, culturally appropriate, but also we want to address your allergies and who lives in your household and really make it exciting, because food is a joyful thing, right? And the last, not least, is health equity. We know that part of the cost burden in the healthcare system is because we have these inequities, and food plays such a huge role, both in progression of disease, but also like if you can't afford food, are you going to try to afford your medication copay or other things, right? They're needed for prevention. So we kind of think about all of those aspects with different solutions that we have in the market. For the preventive and the day-to-day, I talked about Sincerely Health and the connections we're making with customers who are their own agents, right? They're saying like, hey, I'm going to take control of my health. I'm going to lean in. So we give them things like connected trackers. So your CGMs and BGMs, your Auras, your Apple Watches, and any type of device that you have. We reward them for that by giving them healthy points and in some cases just direct coupons that they can redeem for healthy foods. So we understand that preventive health is not easy, right? You have to have motivation and you have to have sustained motivation. So we're using some behavioral tools there to bring them to better nutrition and help them sustain that. In terms of disease management, some of the food as medicine programs that we have do provide full medically tailored groceries. So we kind of check a couple of boxes there. It's appropriate for your disease state. So let's say it's for diabetes, it's low carb and high in fiber, but we're also giving you fresh food. It's a little bit of a difference from what the industry and a lot of health plans have covered before, which is typically frozen meals that they're great post-discharge. But when we want to actually change behaviors for life, we think fresh food is best. Fresh nutrients or frozen. And the last one, health equity. I think we play a role in terms of screening. So HRSN screenings can be performed by a pharmacist. And in fact, we have some programs kicking off this month in that vein. We have access to a large number of people who use our loyalty program. So we have over 40 million customers regularly engaging with us. And do we have the responsibility to let them know about a SNAP match program that's available in their state, or about Medicaid funded food program that covers medically tailored groceries for them? We feel like we have the responsibility, and we also can help health plans kind of close some of those gaps related to health equity, because, members just don't engage with health plans at the rate that they engage with us, just due to the frequency of interactions.
100%. Man, there's so much you said as taking notes on my phone. We were chatting. First thing that you said that I think is fundamental, and I think it's becoming a theme for this season, our show, is you referred to your customers as agents. And in a number of interviews we've done recently, again, with Oura Ring and some others who are really playing upstream, that concept of consumers needing to be empowered so that they have agency is coming through to the fullest extent. And it's certainly something we don't typically see traditional health system leaders talk about. And so wanted to call that out as something very powerful that you said. And it sounds like then that the Sincerely Health platform really helps to give that agency back to your customers to ultimately select the right behaviors, the right nutrition, and the right medications as they pursue their health journey. Would you say that's the case?
Our typical starting point for a customer is they take a health survey. It's an actuarially based questionnaire, essentially, that gives them a health score. And that score is comprised of 7 different areas that roll up into one score, but then they can click into each area. So let's say activity is an area of low score for me. So naturally, I will probably want to connect a tracker and work on maybe something basic as increasing my step count. For someone who's more active, maybe I want to take a challenge and, start prepping for a marathon. It doesn't matter where you start. This notion of take the first step and we'll help you along the way is really how we want customers to feel when they come into our environment. So activity is an easy one, and you referenced different wearables a couple of times. So I'll stick with that. As an example, to really reinforce this sense of agency and make customers feel rewarded for their actions, we have a program with Apple where we reward customers for closing their rings daily. So if it's 3 rings that you have on your list to close, each ring you'll get 25 healthy points per day. It's not a lot in terms of effort or in terms of reward, but it's an interesting phenomenon and how it changes behaviors, because they get behavioral reinforcement in Apple Fitness because they see those rings closed visually, right? Then they get a reinforcement in our app because they're getting something toward healthy groceries, which is probably also related. No one is going to say no to that. We see ourselves as a partner in that journey. And for customers who are their agents, we want to be there for them. I just saw an app rating for Safeway store literally last week. And a customer mentioned specifically he was using Fitbit as his device of choice. And he said, you guys reward points just for existing. So we take that friction out of customers' life for, yes, if it's 10 more steps for you today and 150 more steps for you tomorrow, do that. We'll reward you for that. That customer, by the way, reported that they lost 30 pounds after a year of being with us. So in their case, they wanted to live better and we were there for them.
It's opening my mind to what's possible with grocery retail in general. And it's not even just grocery, that just happens to be the location the type of location you're talking about. But then you add the Sincerely Health side of this, and now you all of a sudden have this digital engagement layer happening in addition to in-person. I just wonder, this is becoming more of a true health and wellness destination that is in personal and digital. Is that kind of the goal here? And can that truly happen? Can this truly be a destination? And what were your thoughts on that?
I think it can be. So as I think about areas that are not the growth is continuing, omni-channel and e-commerce engagement, right? Even older people are aging into digital engagement and participating fully in that, right? So digital seems to be the right channel to kind of connect the dots. Access to care, I mentioned earlier. Access to care is becoming a problem for traditional healthcare. So I think retail absolutely has a role to play in complementing existing traditional sites of care with retail pharmacies, retail clinics. And then people make day-to-day decisions on their phones, today. So if we're not engaged with them there, we've probably missed a lot of things that are going to be costly and really bad for consumers, for patients, if we don't engage with them in the right way. So we're seeing early results of behavior change. We're seeing our ability to impact that connection between digital and in-store through Omni. I'm very optimistic about the role of retail and healthcare and in primary care.
I love it.
Jared, I'm seeing a shift when we first started talking about retail health years ago and talking more with our health system partners. the play was always convenience. People thought that retailers would get into health because they could offer a more convenient service, which is probably true. But what I'm starting to think now is the real opportunity is these retail partners can help either partner with hospital systems or, just partner with the individual to start to think about upstream interventions, be it food, pharmacy, and focus more on that wellness piece as opposed to intervening when you're actually sick or, you're bleeding out or you have diabetes already. And so I'm starting to see that as the real opportunity based on all these conversations we've been having.
Today, HHS published a virtual toolkit on food as medicine, and they really made a big effort to make that accessible, not just for entities who have historically played in health equity and food as medicine, like community-based organizations, food banks, things like that. It's very comprehensive, which tells me that the government is definitely thinking about the role of food, the role of retail as part of the solution to our healthcare expenditure, what I would say crisis, right? So to your point, if we get the right decision makers and health plans to really evaluate all these interventions in the right way that can impact their downstream spend, then I think healthcare will change. There are lots of complexities in how it's done from an actuarial perspective and, really attributing the value of retail interventions, whether it's food or others, to downstream benefit. But I think HHS is seeing it. Health plans are seeing it. Retailers are embracing it because we have so much opportunity because we're close to the customer.
What I'd add to that, there's this confluence. And so the other thing that I would add is I think your everyday consumer is seeing it. And so what I mean by that is, within the last couple of months, I think there's been some very high profile interviews done on, the state of food in this country and how important the food piece is to your overall wellness. Obviously, there's some political candidates that are running in this election cycle that care about this deeply. And then even, I think this week, Jillian Michaels, who was from The Biggest Loser, was testifying in Congress about issues. And so I think the food piece especially is now, I would say some of my friends who were never really healthy or never into talking about the ins and outs of what's healthy, what's not. I hear them talking about this now. And so I know something has shifted. And so I could totally see, the work that you all are doing at Albertsons and, other retailers starting to become very popular and more people, uptaking your services. Because I think it's at the top of people's minds right now.
I love that train of thought, Zane. And I'm curious about, I guess, a theme that we have been talking about, again, a lot lately that has to do with preventive health, right? And we've been referring to them as healthcare adjacent areas. And I'm sure there's a better term for it. But it's the things that when you're solely looking at health and wellness through the lens of traditional hospitals or sick care, as we refer to it, let's get you well now that you're sick. That only gets you so far. And so when we're talking about other areas that we are seeing start to become more attached to health and wellness services because some entities, some organizations are getting that insight, that consumer insight of I look at health and wellness through the same lens. I don't look at, hey, what do I want to go see a doctor for today versus how do I want to keep myself well today? It's all one thing. I just want to feel good today. So a lot of those traditionally adjacent areas, things like fitness and weight loss and mental health and sleep, those are things now that are becoming, they're more on the radar screen of healthcare organizations, not just solely out on their own as services. And we're seeing them incorporated in consumer journeys as we take a look at how do you, again, why am I trying to spend time or money losing weight? Because I want to feel better. I want to have more availability today. And when we really look at those needs of a consumer, of a health consumer, that's what helps us start seeing these other adjacent areas. So I'm just curious how Albertsons may or may not fit into that, or if there are services or plans in any of those adjacent areas.
Going back to the comment that Zane made about agency, we see a couple of interesting trends. And Jared, what you call I want to feel better, it's kind of this trend for self-care and really investing in your wellness and prevention with an open mind, not thinking about, is it covered by my benefit or not? Or do I even understand what my benefits are in that area? So I think longevity and self-care are big areas. I talked a little bit about our incorporation of devices. For a physical activity, it's not just devices. So if you have the simplest device nothing fancy. You can engage with us in a variety of fitness goals that stem from like, I'm going to go to the gym every day and log that to all the way to, I'm going to track my marathon prep through a connected tracker and progress through levels. The same thing with sleep. To the extent you chose to transmit some of your information, let's say through your Apple Health Kit, we can help you set goals for going to sleep on time and getting enough sleep in a given week. And we'll reward you for that. If someone has an intent of losing weight, it's not just going to be that they need to restrict their calories only, right? It's a plethora of things that include sleep, include activity. So we can help with all of those components. For nutrition specifically, customers can set up their nutrition profile in our app that specifically says, okay, I'm going to focus on lower carb consumption. I have 2 adults in my household. I have a child with a peanut allergy. So, and then we help them track what they actually purchase from us across 5 food groups. So we'll tell you, okay, 90% of your purchases in the last week or a month were for essential foods, and you reached your fruits and vegetables and lean protein and whole grains this many times. And then 10% of your purchases were occasional. Essentially, it's junk food. We don't want to call that, but there's no nutritional value to it. Just serving up insights that tell you where your baseline is makes a huge difference on behaviors, right? Like once I see I'm consistently not getting fruits and vegetables, I start working on that. That changes the composition of what's on my plate. It doesn't have to be what you purchased in our stores. It could be I went out and now I'm paying attention to adding broccoli as a side versus something else. So we offer, Jared, to kind of answer it succinctly, we offer these adjacent solutions today. We're doing a lot more work to make them highly personalized journeys that can fit, some specific intent. And we'll be rolling out some of those in the coming months, actually.
I always like to lead, I guess, where all this brings us, right? So we like to ask our guests just like what gives them hope for the future of healthcare in this country. And the background on that is being in healthcare, it's really easy to focus on the negative, really easy to focus on things that are broken, things that aren't delivering health, making people better, or we see too much, too much about how things work and where incentives aren't aligned. And it can all just bring you to a place where you're like, where's their destination here? And then we speak with guests like yourself and genuinely it gives us hope because we hear the efforts that are being made in other areas that aren't as established as traditional sick care. And I think that's good. I think it's good to hear the innovation there. I'd love it from your perspective. What gives you hope for the future of healthcare?
I'll speak from a perspective of a retailer. Even though I've worked on the intersection of retail and healthcare for many years, looking, let's say, as a retailer outside in into healthcare, I think we've been talking about the rise of consumerism in healthcare in different ways, right? We talk, people pay attention to their copays. Maybe they look for a different side of care. All these things are creating a sense of like, they have to compete for that patient, for that consumer. They have to improve both the cost of care for them, things that they're at risk, but also how that patient genuinely feels, not just on a physical level. How do they feel about that service? And I think that also creates a shift to the things that I'm excited about. How do we really, really at scale move people to think about preventive services? How do we get them to think about being agents of their own health? And what supports does the health plan, let's say, provide for that, right? Half the time people don't even know what's on their benefit. And a lot of times they have disease management programs on their benefit. They have some supports like things like FSA. People a lot of times don't even use FSA for what they could. So I think a lot of technology and a lot of changed focus that healthcare stakeholders have on that consumer experience is going to make a difference because people are going to opt into existing solutions a little bit more. That's for the good. And we need that change.
Definitely hear you too on that piece where people don't even fully understand their benefits. I know we had, was it Omada here on the show not too long ago, and they were chatting briefly about their partnership with Amazon, which more or less is just to help Amazon customers understand when they potentially have the benefit. And so that's a huge, huge problem that I'm glad you all are keeping top of mind.
Agreed. It's been such a pleasure to dive into this because it really does open our minds and our eyes to what's possible. So We like to wrap up asking you something that has nothing to do with any of that, but it helps us. So I admit it's a little self-serving in a good way. But I would love to hear if you could pick a guest for us to invite on a future episode of the podcast. Who would that be and why? And I will preface it saying it doesn't have to be somebody that you personally know or could refer us to, but we'll take that if you've got it. Who might you recommend for us for a future episode?
I won't name names specifically, but I think it would be interesting to have a decision maker from a large health plan who can think about reinventing the benefits offering of 2030. What should it be? And how do we shift from sick care to preventive care? And like, how is it even possible from a normal actuarial side of things, and what needs to change?
That would be a great episode, actually. My wheels are turning just thinking about it. I wonder if like a group like Firefly Health would be a good first step, or even like Transcarent. I know they're not fully health insurance, but we're getting close.
Yeah, but definitely Transcarent. I mean, they think about coordinating and navigating care, choosing the most cost-effective. Yeah, for sure. That would be an interesting conversation.
Get United Health Group on here or something.
Right. Love it. It's been such a pleasure. And with that, that's a wrap for this episode. We've enjoyed speaking with Irina Pelphrey from Albertsons. And thanks for giving us so much to think about. Thanks for joining us today.
Thank you.